Okay, so imagine a medicine that is essential to every cell in your body. Deficiency of this medicine causes autoimmune conditions in the thyroid, such as Hashimoto's, Graves' disease, causes fatigue, weight gain or loss, poor digestion, low IQ in children, helps your body get rid of heavy metals, such as mercury and lead. The list goes on and on. So we're going to talk about its history and why you need it and how much you need. So this medicine was discovered in 1811 by a French chemist, and it was called the universal medicine for probably 100 years or more, because it was used for so many conditions. And we've known about it, as you see, for a very, very long time. It's an element, and it has number 53 on the periodic table. And it's part of the group of halogens, which include fluorine, fluoride, chloride, bromine, bromide, and astatine. And because all of these elements are very similar in shape, what actually happens is they fight over the receptors. Now, as we said, the universal medicine is needed by every single cell in your body, but they compete for the same receptors. So if we have the other elements in our bodies that are toxic, because all the other ones are toxic, it can worsen conditions in the body in many, many ways. For instance, bromine is used in some antibacterial pool chemicals. So if you go swimming in a pool and it's got bromine in it or chlorine in it, it will get into your body. If you swim in a pool for an hour, you'll weigh on average 1 kilogram more, because your body absorbs the pool water. And as it absorbs the pool water, so you will absorb the chemicals with it. And it's, as I said, bromide is used in pool chemicals. It's used as a fumigant, in pesticides, and some pharmaceuticals and carbonated drinks. So they put this into a lot of different products. It's even in some of the breads, and we consume this on a daily basis. Then another thing which we've all heard of is fluoride. Now, it's in dental products, and it's linked to behavioral issues. And you'll find that many dentists are still recommending fluoride, even though it has tremendously damaging effects in the body. It's related to hypothyroidism, that's an underactive thyroid, hip fractures, bone cancer, kidney damage. Then we've got chlorine, which is linked to heart disease and cancer. And in fact, chlorine was fingered as the largest cancer causer in the 20th century. Now, that's obviously up for debate, but it was a big factor in the whole thing. Now, if you have enough of the universal medicine present, then it displaces these toxins, because being the same shape or very similar shapes, when the receptors are available, then the universal medicine will go in, and it will displace the other toxic chemicals or elements. Now, when it was discovered, it was the beginning or birth of Western medicine. And the element I'm talking about is iodine. Iodine is so important to our bodies that if we could remove all the iodine from our bodies, within 1 hour we'd be dead. So imagine that. You could live for maybe 10 minutes at maximum without oxygen, but if you took away all your iodine, you would die within 1 hour. So it was the birth of Western medicine when this was discovered, because it's the first time that a single element, which is iodine, was used to treat a single illness, which was a goiter. Now, goiter was a big problem in the past. And what they did is they used 1 drop, which was 33 times what they recommend today to treat goiter. And the goiters disappeared, just like that. Goiters are a swelling of the thyroid gland in the neck, and it was a huge problem, especially in areas that were very low in iodine. Now, iodine became widely used in Europe in the 1930s. It was introduced into iodized salt. The whole reason that it was introduced into iodized salt is that in the central areas of America, which was far from the sea, iodine levels in the ground was virtually 0. So they were having goiters, and virtually everybody, almost everybody in those areas had goiters at the time. But they had a war to fight, and the war was coming along, and they couldn't take people into the army with these goiters. So they decided to add iodine to the salt. And there are other ways of getting it in, but that wasn't a bad idea. And it worked quite well because goiters disappeared. However, something else changed later on, and that's that people were told not to eat salt. They were told, don't eat salt because it creates heart issues, etc. And we know very well that salt is an absolutely essential component in the human body, but it's just the correct type of salt, because your normal table salt is treated with so many chemicals and all the nutrients are removed, so it's almost purely sodium. So that is extremely bad for you. And with the treatment, what happens is that salt actually scours or damages your arteries and veins. So then you have cholesterol coming along, manufactured by the liver, and going along to try and treat the actual scouring and damage to the arteries and veins, especially the arteries. But getting salt in, that was great, but most people don't eat that much salt anymore, especially iodized salt, because there's this great fear. It's a fear that's been put on people, and we know that we do need salt every day, but a good, decent salt. But there are other ways of getting it in. Now, most people know that iodine is an essential trace mineral supporting the thyroid gland, and it's a gland found in the base of the neck, and iodine is needed for the production of thyroid hormones. You get T3, which is an active form of thyroid hormone, and then you get T4, which is an inactive form of thyroid hormone. Now, the 3 and the 4 stand for the number of iodine molecules or atoms bound to this protein hormone. So what we do know is that you also get T1 and T2. Many people will tell you it doesn't do anything, but actually the body doesn't do anything at all for no reason. So we know that T1 and T2, which is 1 iodine and 2 iodine molecules, actually do something, but we don't know what it is yet. And we will learn eventually, I guess. However, you get T4, and about 80% of T4 is converted to T3, which is the active form in the liver. So if your liver is not functioning well, then you won't have this conversion taking place. And it's a real problem. And then about 20% is converted in the kidneys. One also needs selenium to help with this conversion. Now, many times you're treated with, if you have a thyroid issue, you're not treated by adding iodine, you're treated by adding T4, which has to then be converted to T3. But if your liver or your kidneys aren't functioning correctly, it will not help you. So you won't feel much better. And even though your T4 will rise, but as I said, it's not an active form. So it is a real problem. But the good thing is that you only need to supplement with iodine in most cases, and that will give the thyroid gland the nutrients it needs. And that is for an underactive and an overactive thyroid. But iodine's been attacked by so many people, saying it's toxic and it's this and it's that. But in fact, it's absolutely essential, as we've seen tonight. So kidney problems, liver problems can affect the thyroid, and the thyroid certainly won't function correctly. And of course, we know that the thyroid is your master gland, which affects all the other glands, your metabolism and all kinds of things. So we need to get our livers, and we need to get our kidneys functioning very well. And that's where we talk about detoxification and other things, which is not part of tonight. But we need to have them, livers and kidneys, working very well. If you don't have a thyroid that's functioning well, you'll have lots of symptoms, such as a slow metabolism. Now, we know what a slow metabolism will do. It'll cause you to put on weight. Or you could have a fast metabolism, which could cause you to lose weight. And in fact, if you have a hyperactive thyroid, which is an overactive thyroid, hypo is under, hyperactive, you can have all kinds of thoughts, destructive thoughts, suicidal thoughts, and all kinds of mental issues. And that is a real problem. Then you could have thinning hair, poor quality and brittle nails, mood issues, weight gain all over your body, and weight gain in areas that you haven't had weight before. So instead of it being around the midriff, it could be on the legs, all kinds of different areas. And you could have nodules on your thyroid, many other conditions. Goiters aren't as prevalent today as they were, but they still are an issue. But certainly nodules, I was speaking to a person I know, it's actually a friend of mine today, and he was telling me that his wife had a hyperactive thyroid, and what they did is they refused her any iodine. They said iodine will poison her. So they refused that, and they took equipment, and that burnt most of her thyroid away. And she's suffered ever since then. She only has a very small part of her thyroid left, but she supposedly is not allowed to have any iodine. And he actually is very scared to give her iodine, not even any dose at all, because of what he was told by the practitioners who were treating his wife. So it was very destructive, and she's never been the same since these events took place. Okay, Peyronie's disease. This is a fibrous tissue that affects the penis and puts it out of shape. So what actually happens is it's fibrous tissue, and luckily iodine, when applied topically and orally, can actually take away additional extra fibrous tissue. So it can possibly be cured, but certainly improved with iodine. Right, blocked arteries. We've spoken about blocked arteries before, and we know that there are a number of different factors with blocked arteries. For example, we know that vitamin C is very important because of connective tissue in the arteries, but we also know that there is an infection in most people who have artery issues, and that is in the walls of the arteries, and that's a chlamydia infection in the artery walls. And this chlamydia infection causes absolute damage, and then the liver will generate LDL, which is your supposedly bad cholesterol, when in fact it's just your repair cholesterol. And it will go out, and unfortunately it's very sticky, so it will go to do repairs when actually you're dealing with an infection. So with iodine, it can open up blocked arteries, and it can also take care of that infection, because iodine is antibacterial and antifungal and antiviral. So it can take care of all of these different conditions when it comes to blocked arteries. Obviously, it's not the only thing that one would do, but it's one of the main things that one would do as far as arteries and heart conditions are concerned. Right, then hormone balance. A lot of people have estrogen dominance. Now, the body, what happens generally with estrogen dominance is that the body continues to make estrogen, but not progesterone. So the estrogen rises, but it's not balanced by the progesterone. So as that happens, we see mood swings, irritability, decreased sex drive, worsening PMS symptoms, irregular menstrual cycles, heavy periods, bloating, weight gain, anxiety, panic attacks, and hair loss, trouble sleeping, fatigue, fertility issues, memory problems, and brain fog, flushes, or in America they'll call them flashes, and night sweats. And it's even gender bending for guys. So high estrogen has an effect on sexual orientation, and that is a huge issue with many people. We know that high estrogen and high dopamine are related to gender bending. So they've even called these drugs date rape drugs. When I talk about drugs, I mean hormones. Okay, so iodine helps to lower bad estrogen and increases good estrogen. So what we find is that estrogen is made in a form that's very toxic from plastics. So drinking out of plastic bottles generates xyloestrogen, which is a very, very destructive form of estrogen, and not an estrogen that the body can use. So plastic bottles, your supply, your water supply comes in, and there's a lot of plastic in the ground, electrical plastic surrounding electrical wires, plastics in the dams, plastics in the seas, all over. We're just surrounded by plastics, and we should be filtering our water and filtering it very well, hopefully with a reverse osmosis filter or a distillation filter, which works. But I've tested the waters from distillation. I've tested the waters from RO, a working RO system that works well. Reverse osmosis gives you cleaner water than a heating system where you're actually boiling the water and letting it bubble off. So iodine helps lower bad cholesterol, increases good estrogen, and may balance estrogen dominance. And some will treat it with progesterone, but that is not really solving the actual issue. Okay, heavy menstrual cycles. That is a big problem with many women. And in fact, 1 in 5 women seem to have this issue with heavy menstrual cycles. And it's a problem because women lose blood and they become weak and anemic. And there are a lot of problems with that because their iodine is low. It's one of the main causes. So a normal estrogen cycle will have balanced hormones, balance between estrogen and progesterone, and that's fine if you have enough iodine. If you don't have enough iodine, then what will happen is there's a buildup in the lining of the uterus, the endometrium, which is shed during menstruation. And if a hormone imbalance occurs, the amount that is shed is far greater than one would expect, causes heavy bleeding, pain, and all kinds of issues. And that's a real problem. Right. Now, hot flushes. 75% of women experience hot flushes. Imagine that. 75% of women. Now, I once had a hot flush, or twice had a hot flush, and it was absolutely terrible. Can you imagine, and if you're a lady, you'll know what I'm talking about, having a hot flush every day and often? That is got to be one of the most terrible things. Increases blood flow, rapid heartbeat, shortness of breath. But one of the ways to get rid of these flushes is bring iodine to the rescue. So we should, especially get our iodine balanced. We need to have the correct amount of iodine in our bodies so that we can deal with all these different issues. Now, cysts, many cysts form and they can be treated with iodine. Now, iodine helps to shrink cysts. In fact, one of the things we do is we do a thermal image. And we can look at breast tissue, and we see that there's a lot of inflammation. Then what we do is we tell the person, the lady, to take iodine orally on a daily basis and apply iodine to the breasts. And when she comes back for the next scan a month or two later, normally it's corrected if there are cysts in the breasts. So those are something that can be treated using iodine. Ovarian cysts, thyroid cysts, they all develop because of low iodine. Now, the nodules that develop can even turn into cancer. And the good thing is that iodine has anti-cancer properties. So it's absolutely such a wonderful universal medicine that's been left by the wayside, because in the 1950s they brought out antibiotics. Now these antibiotics were used to treat what was treated with iodine before. So that is viruses, bacteria, all these different issues were then treated with antibiotics. And antibiotics have their own set of problems, damaging the immune system, destroying the friendly bacteria, the microbiome, and all kinds of issues, whereas iodine doesn't do any of that. Iodine only goes after the bad bacteria. And in the old days, many years ago, and I remember when I was young, I cut my finger. What did mom do? She applied iodine to my finger so it wouldn't become infected. So this was something that was used a lot in Europe and all over. So it was really something so useful, and we've let it go by the wayside. We've tried all kinds of other remedies, and many people rush off and get an antibiotic when absolutely the best way would have been to use iodine. Now, what about the prostate gland? We see that there's benign enlargement of the prostate gland, there's cancer in the prostate gland, and many men suffer from benign or enlarged prostate. And that has issues, as I'm sure everybody's aware, with urination. So we have people coming in and they say, I go 7 times a night, I go 8 times a night, this type of thing. However, think about this. If you have a goiter, what is that? A goiter is an enlarged prostate. Why does it enlarge? Because it's trying to uptake more iodine. Now, what about this? What if the prostate was enlarging because it wasn't getting enough iodine? If it got enough iodine, it wouldn't have to enlarge, and then you wouldn't have all these issues. Plus, it has anti-cancer properties. So, iodine should be one of the things, especially for hormone cancers, but for every cancer, because every cell in the body needs iodine. It should be one of the parts of our treatment of cancer and enlarged prostate. Very, very important. Another remedy that we use for enlarged prostate, which works extremely well, is pine oil. Pine oil and honey has reduced PSA, which is a protein that your prostate releases, from in the thousands in some cases we've had, down to 0.5, 0.1 over a period of time. So those are the two things that are absolutely essential if there's an issue with the prostate gland and any cancer at all. Very, very, very important. Okay, fertility. A lady who is wanting to fall pregnant has a 46% less chance of falling pregnant if her iodine is low. Imagine that, 46% less chance of falling pregnant. And we know that today, in this modern age, because of estrogen dominance in men, that the sperm count has dropped. But if the iodine is low, the hormones aren't regulated, and if those hormones are regulated, then it will help with conception. And this is so important for so many youngsters today, where they want to have a child and they just battle along, and it might just be an iodine deficiency, which is putting their hormones out of balance. Okay. Now, when a person falls pregnant, when a lady falls pregnant, the mothers require much more iodine because of the child within her. And the FDA, which we won't talk about, but they say that you need 220 or to 240 micrograms per day, and 150 micrograms per day for a normal person. Now, 150 micrograms is almost nothing. What we can learn, though, is that thyroid hormone is very important for the baby's nervous system and the brain development. The baby's brain can't develop without iodine. Now, it's interesting that low iodine in a pregnant mother can cause birth defects like stunted growth, heart defects, and even hearing loss. So this is a huge problem for children. And in fact, it can cause other issues like the IQ of a child whose mother has enough iodine, whose iodine is sufficient, can have an IQ of 100, and a child whose mother has not enough or has too little iodine can have an IQ of 80. So 20 points difference in the child's IQ, just depending on the mother's iodine in her body. Imagine that. Imagine what that would do to a child's life. 20 points down, low iodine, 20 points up, high iodine. The 20 points down means the child would probably battle to support itself, and 20 points up would probably mean that you've got a go-getter, you've got somebody who'll have their own business, will be alive and thrive. What a difference. Now, another factor is that when ladies fall pregnant, they often end up, or sometimes end up with a hypothyroid, so an underactive thyroid at the end of the pregnancy. The reason for this is that when the lady falls pregnant, estrogen spikes, and then it's a real problem because there's not enough iodine to balance the estrogen, and she ends up with hypothyroid at the end, which is a real problem. Means she puts on weight. Have you ever seen a lady when she's been pregnant, she's had the child, and she just can't lose that weight? She can't lose it. Friends, she should be taking iodine. She should be. Now, another fact is hormone replacement and birth control pills that increase your estrogen, but that's an artificial kind of estrogen, which is very, very dangerous and can cause cancer. So birth control pills and hormone replacement are known as carcinogens. And what we need iodine to combat this. Otherwise, we're at high risk, or these ladies are at high risk of cancer and other issues. Non-organic food can increase xyloestrogen, which is a bad part of estrogen. As I said earlier, plastic bottles. So there are many, many things in our environment that cause this issue. Okay, growing children. Now, children need iodine for brain health and to support their spinal fluid. So there could be growth issues. Iodine deficiency can lead to learning disorders like ADD and ADHD. As I mentioned earlier, lower IQ and lower intelligence. So as the mother is breastfeeding or lactating, she needs to have enough iodine. If she doesn't have enough iodine, it could be devastating for her child and for herself because she needs that extra iodine. Lower intelligence, lower cognitive abilities, ADD, so hyperactive disorders, all these different factors come into play. So it's very, very, very important that the mother balances her iodine and gets the right amount. Mental health. So lower iodine, slow learning, poor problem-solving skills. Imagine that. You're battling to solve problems and issues, and it could be low iodine. That's a major contributing factor to it. Depression. Many people suffer from depression. And I had a fellow come to see me the other day, and he suffered from depression since the 1970s, early 70s. And during the 70s, they put him on electrotherapy, and they burnt his brain with electrotherapy, and he's never been the same since then. And he's still suffering from depression even now. So we're going to be looking at that, but it's a big, big factor that some of these treatments are absolutely criminal for depression. My uncle, Uncle Ivan, he's now passed along, but Uncle Ivan was depressed. But Uncle Ivan had an opinion about everything. Uncle Ivan used to argue and really had an extremely strong opinion about any subject. They put him on electrotherapy where they burnt his brain, and he was never the same. He couldn't even hold a proper conversation after that. And chances are he was deficient in nutrients and iodine. So very, very sad. Iodine can improve your mood if you're depressed. Nobody really knows why. Maybe because it affects your neurotransmitters in your brain. We know we've got the dopamine, the acetylcholine, the serotonin, and the GABA. Those are the main neurotransmitters. So iodine most probably affects those, but it could just improve your thyroid function, and that can improve your mood. And if you're depressed, it could improve that, and it could change so much in your life. So it could be absolutely life-changing. Now, the liver. The liver has over 500 functions, from detoxification to generating hormones, from sugar balance, there are just so many things that the liver does. And if the liver isn't functioning well, we leave ourselves open to many conditions. Our bodies become toxic. We leave ourselves open to cancer and all kinds of factors. But iodine helps to break down many of the issues that are affecting the liver, like high chloride, bromine, fluoride. Iodine helps to detoxify mercury and lead. So if you have enough iodine, it will remove mercury and lead from your body. And we know how dangerous these are. I'll give you an example. If you have heavy metals like mercury and lead in the gut, then you won't be able to absorb nutrients because they will overpower the gut, and the gut won't recognize your nutrients. So they won't be absorbed, they'll be excreted from the body, and you'll end up with very low absorption, low nutrients, which will cause havoc within your body, because we know that you need nutrients and you need detoxification. Without that detoxification, you won't be able to function correctly. So it also helps to regulate blood sugar, and it's required by every cell. Now we know that blood sugar is regulated by the liver and by the pancreas. We also know that the pancreas is more involved, 98% involved with digestion, and only 2% involved with sugar regulation, which is insulin. So if it can function better, and as we said, every cell needs iodine, it can regulate your blood sugar. And we know that high insulin will cause inflammation. And inflammation is the basis of most chronic diseases today. So if it regulates and keeps your insulin low, you don't need as much insulin, the pancreas will function better, won't have to overwork, it won't stress the pancreas, so it will be so much better. Bronchial secretions, that's another factor where if you have bronchial infections, one of the ways is to nebulize with iodine. Now, iodine in a nebulizer at very low amounts, maybe half a drop. So how would you get half a drop? You would mix one drop and then pour half of it away and add water to it. Would help to remove secretions. It would help to kill any infection in the actual bronchial tubes, in the lungs, in the sinuses. Very, very important. Fibromyalgia. Sometimes fibromyalgia is just an iodine deficiency. Fibromyalgia is pain in a number of areas in the body, often in the back, the joints, all over the body. The first place to deal with fibromyalgia is iodine. It can be an infection, and I'll give you an example. Last week, a lady came to us and she had fibromyalgia. She did one Rife therapy with the original Rife frequencies, and she came back a week later and she said, wow, my fibromyalgia has disappeared. So that was clearly an infection. Now, if you don't have the correct Rife, it's not going to work. However, what you can do is you can take iodine, because that could clear the infection and whatever else is causing that inflammation that is causing the fibromyalgia. Dealing with things that we're treating with very, very strong drugs. If one goes to a rheumatologist with fibromyalgia, you'll be injected from top to bottom with drugs, and it won't get to the problem. It'll increase the problem because those drugs will cause more inflammation. And yes, they might have a short-term effect, but in a long term, you'll get far, far worse. Whereas here, we might just get to the root cause, and that could solve the issue. Your immune system. Your immune system needs iodine because it's antibacterial, antiviral, and anti-inflammatory. So it supports the white blood cells So your immune system, your lymphocytes, etc., protect you against foreign invaders and infections and diseases. So we know that these cells need iodine, and if they don't have them, then there is a huge problem. Now, there have been studies, and one of the studies was where they used rats, and they put the rats in an environment where they had viruses. Now, I know there's controversy on whether viruses exist or don't exist, and we won't get into that because this is a study that was verified. They placed a drop of iodine on the noses of half of the rats. The other half of the rats never had the iodine. All the rats that didn't have the drop of iodine were infected with the virus. The ones that did have the virus, did have the iodine, never got the virus. So, whether you believe that viruses exist or not, that is a study that took place. Okay, weight loss. We know that many people battle to lose weight. Weight can be put on if your iodine is low, and then therefore your thyroid is not functioning, your metabolism won't function correctly. The weight gain is a huge issue around the stomach area and different areas that you probably never had weight gain before. Now, if we get the iodine balanced, we get the thyroid balanced, it becomes easy to lose that weight. And we have a product called Thyroid Under. Thyroid Under, and remember all of our products are available on the BioSol website. Thyroid Under contains some iodine, but we'll sometimes supplement with extra iodine. And I had a lady come in. She was 30 pounds, I don't know, quite a lot overweight. All she did is Thyroid Under, and I don't even think she did supplemental iodine, but she got the iodine. She lost, I think, 5 kilograms in the first week, and she didn't change anything else. Just changed that. I had another lady come in recently, and she was brought to us by a medical doctor who brings a lot of patients to us. This medical doctor comes from Soweto, and she brought this lady in. She had an overactive thyroid. She couldn't work. She was in such poor condition. We gave her thyroid over for an overactive thyroid. We gave her supplemental iodine. The doctor told me on Saturday that she'd now gone back to work. She was able to work now, just by giving her the nutrients and the iodine for an overactive thyroid. Now, if you go to a thyroid specialist, they will tell you, don't even think about giving a person with an overactive thyroid iodine. But it is, of course, the universal medicine. So we know that it does so much good. Cold hands and feet. Have you seen people with cold hands and their feet, and hands and feet are always cold? And people will say to them, oh, you've got poor circulation. You've got poor circulation. You must do something about your circulation. Well, the good news is that cold hands and feet is usually a deficiency in iodine. And when your thyroid hormones are regulated, your temperature is controlled. It balances your hormones. When your hormones are balanced, your temperature is balanced. So it will often disappear. So imagine winter and your hands and feet are normal temperature. Isn't that wonderful? Sinus health. We often get sinus infections, bacteria in the sinus, and mucus, especially in winter. These things strike a lot of people. Now, a sinus rinse with iodine can help to clear that kind of infection, help to control the phlegm, and it controls mucus production. One can use a nebulizer or a spray with a very, very mild dilution of iodine in it. So all these things are available to us. They're cheap. They're not going to cost you an arm and a leg. They They are things you can do yourself if you have the knowledge. All people need is the knowledge. And there is a verse in the Bible that says, my people are destroyed because of a lack of knowledge. And we know that is so true. Our people are destroyed because of a lack of knowledge. We're taking these strong drugs. For example, people treat dehydration with strong drugs. If you are dehydrated, you could get a headache. So what do? I'm not saying anybody on this group, but many people will take a grandpa or some strong destructive chemical or a sore back, and then they'll take painkillers. But actually, most of the time, that's just dehydration. Your back, the discs in your back become dehydrated, and then they take strong drugs and inject cortisone and all kinds of very, very destructive chemicals that can destroy your back, destroy your spine, destroy your vertebrae. And it might only be dehydration or a lack of iodine. Okay, cystic acne. Cystic acne is a problem with low iodine. That's normally the reason. It can be the liver, but generally the first place to start is to balance the estrogen. If you balance the estrogen by taking iodine, that will normally go. Because it's a hormone issue. It's a hormone issue. Young women will have it. Different people will have it. Right. Skin issues. Historically, iodine has been used to heal cuts and burns. As I said earlier, when we had a cut or a burn, Mom would apply iodine immediately. And if you speak to people who come from Europe, Eastern Europe, Portugal, places like that, you'll find that that is the treatment that would be used for them. Iodine, no infection. It would change color for a little while, then it would soak into the body because if there was low iodine, it would soak in. And Mom would apply it to her children, and they were much better. Today, there are creams with iodine in, and that can destroy infections very, very quickly. Now, keloid scars. With keloid scars, there's an overproduction of collagen. So if you see that keloid scar, that was a cut, and then there's an overproduction, possibly surgical scars. If one applies iodine topically to that keloid scar within a month, one should see excellent results. One should see the keloid scars shrinking dramatically. So very, very, very important. So a keloid scar can be reduced and often removed completely. And that goes for ordinary scars as well. So skin tags and warts. We know that a wart is an infection, and skin tags, applying iodine directly to skin tags and warts within a month or two. If you do it every day, a couple of times a day even, you'll find that the skin tags and the warts will dry up and fall off. I remember years ago when I didn't know about it, our son had warts all over his hand, and I never realized, this was long before I studied these things, I never realized what the problem was. We took him in, and it was they burnt it off with very cold temperatures, and this poor little child suffered so much. Had we known at the time, we could have just applied the iodine, and it would have solved that problem completely and quickly. Okay, Dupuytren constricture is a painless condition where you've got your hands and fingers have a growth in them, which is knots of tissue that form under the skin. And eventually they become thicker, and then you can't pull your finger up into a bent position. So the finger is straight, can't pull it up, and luckily, And the good news tonight, friends, I'm just bringing you good news tonight. The good news is that iodine breaks down connective tissue. So the good news is apply it to those scars, those tendons, treat it daily, topically, and within a month, your fingers could bend easily. Isn't that good news? Only good news, no bad news tonight. Right. Your parotoid glands help you make saliva, and sometimes stones form in these glands. And if you have enough iodine, you can apply it topically and take it orally. We can shrink those stones away and take them away. So those are in your salivary glands, basically. Okay. Now, I think a lot of people have suffered from a fungus in the toenail or one of the nails. And that's a candida or fungal growth, overgrowth. Now remember, it's in the toenail, so it's in the rest of the body. So how do you treat it? It's very easy. You apply iodine topically twice a day to the toenail itself, and that will help directly to it. But then to get rid of the fungus or the candida, now candida is closely tied to cancer, so one wants to not have an overgrowth of candida in the body. Dr. Simoncini, an Italian oncologist, only treats candida or fungal overgrowth when he treats cancer patients. That is his protocol, and he's had tremendous success, and he's been attacked by many medical bodies, etc. So how do you treat a fungal condition? Well, you apply it to the nail, as I said, and it'll grow out without the fungal condition, but you drink pine oil and honey nightly. Half a teaspoon of pine oil every night will treat that candida, take it out of your body, and it will be well in balance. So that's how you treat a fungal toenail. Okay. After nuclear radiation issues, they use iodine to treat the radiation damage at Fukushima, in Russia. Wherever there's a breakout of nuclear issues and there's radiation, because it comes along in your fish that's caught in certain waters. Your Pacific Ocean fish is full of radiation. So if you get fish that's caught in the Pacific Ocean, you are getting radiation from Japan. And how do you treat it? Well, friends, quite easy. Just take iodine, the non-radioactive form, and that will solve the issue. Okay, so what about natural sources? As you can see, that little fish there, he's probably got some iodine in him. You wouldn't want to eat him though. But if you are not a vegetarian or a vegan, then people eat fish like tuna, but that's not really recommended because the larger fish are absolutely full of mercury, tuna and barracuda and fish like that. So what happens is you want to limit your intake of fish because of that. However, sardines are probably the best fish if you eat fish. If you're a pescatarian or a fish eater, then your smaller fish, like your sardines, are the best one because the mercury is very low in sardines and very small fish. Because the bigger fish eat the smaller fish and they're high on the food chain, so they will be very high in mercury, etc. Now, near the coast, there's a lot more iodine in the soil because as the waves crash, because the sea is full of iodine, but the soils are depleted. So food that's grown nearer the coast will have more iodine. The higher inland or the further away from the sea, the less iodine you'll have in the soils because it doesn't get you. So it's depleted. completely depleted, and over farming is an issue. We know also that that with your commercial farming, what's happened is they use chemicals that kill the earthworms, that kill the bacteria that actually make the mulch that's absorbable by the plants. So the problem with this is that because we have lost this in the soil, it's a real problem, and most soils are depleted. What you can eat is seaweed and sea plants. They are full of iodine, or you can supplement with something like Lugol's iodine, which was invented well over 100 years ago and has been used with great success by many doctors. Now, the iodine test, if you notice there on that slide, someone has painted on their arm a patch of iodine, and that's Lugol's iodine. So it's painted on. And so what you do is you paint it on some of the soft tissue, maybe the size of a 5 Rand coin. And this test is worth more than the 5 Rand. But what you do is you paint it on and you watch. If it disappears within 2 hours, you're definitely deficient in iodine. If it disappears within 10 hours, you're most likely deficient in iodine. But if it's still only just lightens after 24 hours, your iodine is probably okay. This is not the most accurate test. However, it does give you a very strong indication. The problem that we have is that probably 90% of people are deficient in iodine. So you paint it on, you'll probably have it absorbed pretty quickly because, as I say, most people are deficient. Now there's a urine test where it's a urine loading test where you do certain, you take no vitamins and minerals for a few days, then you do a test, then you take 50 micrograms of iodine, and then you do a test every few hours, and you see how much is lost. If you've still got 40 milligrams in your urine after 24 hours, then you know you're probably okay. But we can assume quite easily that we are low in iodine. So how much iodine should we take? As I said earlier, the recommended daily allowance is 150 micrograms. Now remember, 150 micrograms is minute because it's less than, it's a minute point, it's not even anywhere near a milligram. So it will stop a goiter, and that's how they worked it out. Because they saw that if they gave the people 150 micrograms, it would stop the goiters. But the problem is that might help the thyroid to a degree, but what about all the other organs? Because although the thyroid takes most of the iodine, the other organs take huge quantities of iodine as well. Imagine having to supply every cell in your body, and we know we've got probably 50 trillion cells, we think, of cells in the body. Every single cell needs iodine. So what one doctor recommended was you take 50 milligrams a day for 3 months. So you load up on iodine. That's 8 drops of Lugol's iodine a day for 3 months. And then you drop back to 2 drops for maintenance. Now, the Japanese, as we know, have very low breast cancer rates. And we know there are a number of factors involved. We spoke about the D3 that they get from eating oily fish. But another factor is that they consume an average of 10 to 15 milligrams per day consistently of iodine in their meals. 10 to 15 milligrams. They eat a lot of seafood, etc. When I say seafood, I'm talking about seaweed, etc. So if it was so dangerous as certain medical people will tell you, then the Japanese should be dead by now. Because 10 to 15 milligrams is way, way over your 150 micrograms that they're talking about. And there's certain drugs that are used to treat heart rhythm problems and arrhythmias. And these drugs contain 75 milligrams of iodine per tablet, 75. And people take it consistently once or twice a day, which means that they're consuming up to 150 milligrams per day consistently year in and year out. And they don't die. Nobody dies. So what does that tell us? It tells us that they don't die, but they get their iodine and they get better in many ways, because the iodine might be actually what's treating the heart arrhythmias. Now, what's happened? Oh my goodness, let me help this thing again. Ah. I must have pressed the wrong button here. Tandy Michelle, you're going to have to fix this. Okay. I think that we're going to end the slideshow on this note. And what I'll do is I'll just talk a little bit more, because basically what we're saying here is that we'll be taking up to 8 drops a day of iodine consistently, which is what I do. And I know a number of people do this, and we find that it doesn't cause any problems. It's completely safe, and it's about 50 milligrams. So it's a safe method of doing that. Lugol's iodine is the one of choice for us, because it's easy to take and it's very cost effective. So I think we'll end it on that note for tonight. There's a lot more I could have said about iodine, but the time restraints, we've gone over an hour now, so let's call it a night right there. Thank you.